예, 안녕하십니까. 3시 30분.
Welcome back. Now is 3:30, so we're gonna now resume. It's a session 2. I'm the facilitator of this session 2, suicide prevention with community participation. I am Hwang Tae-young. I'm the president of Korea Foundation for Suicide Prevention. So when it comes to safe community, suicide is really important issue. That's why we invited two presenter and two discussants. My apologies in advance because the second speaker, Professor Beck, cannot make it today, but luckily his presentation was recorded. His personal commitment forced himself to make it today. But luckily, Yoshihide Sorimachi will make a presentation in person. Let me introduce him first. He is now the director of the clinic in Aomori, and he is now he was working with the Japan's suicide countermeasure promotion centers. He is now working as the director of the suicide countermeasures. He will talk about national suicide prevention policy and local government responsibility for suicide prevention in Japan. So please welcome him with a big hand.
여러분 안녕하세요. It is a great honor for me to have this opportunity to speak at this conference on suicide prevention policy in Japan and suicide prevention responsibility for local governments. I'd like to express my sincere appreciation to the chairperson of the organization committee, Professor John Pil Cho, the vice chairperson, Professor John Gi-Pei, and all those who have prepared for this conference, as well as to our listeners. Starting with the rapid increase in suicide in Japan in 1998, I'd like to introduce myself and explain the background and thinking behind Japan's Basic Act on Suicide Countermeasures enactment in 2006. Sorry, I took my mask. As an example of comprehensive suicide prevention at a local level, after that, I will introduce the achievement since the enactment of the law in 2006. Next, I will explain the 2016 revision of the basic law. Then I will discuss tools for each municipality to develop a suicide prevention plan. Finally, I'd like to talk about the impact of the COVID-19 pandemic on suicide in Japan. I previously worked as a forensic pathologist and medical examiner in Tokyo and Osaka for more than 10 years. 1998, right after the Asian currency crisis, the number of suicides in Japan increased by 35%. In Osaka City, where I worked as a medical examiner, the suicide rate jumped 67% in 1998. I realized that the motive for suicide had shifted significantly from mental illness to socioeconomic problems, such as harassment in the workplace, unemployment, and suicide by overwork, the so-called karoshi. One day in 1998, I conducted a medical legal investigation of 7 suicides. I thought that this phenomenon meant, in a sense, a catastrophe for Japanese society, and that the suicides were falling into a social pitfall. In Japan, suicide was socially taboo, despite the fact that risk factors for suicide were recognized. In the past, it was a personal issue and was not widely and publicly discussed. After that, from 2000 to 2001, I was a visiting researcher at the Karolinska Institutet in Stockholm, Sweden, researching community safety promotion. Since I came back to Japan, I focused on community-based suicide prevention practice as a public health doctor in Aomori Prefecture. From 2016 to 2018, I worked at the Japan Support Center of Suicide Countermeasures, JSSC. The main task was to support the formulation of suicide countermeasure promotion plans for each prefecture and municipality based on the 2016 revision of the Basic Act on Suicide Countermeasures. I think you are not familiar with the word suicide countermeasures. Suicide countermeasures include both suicide prevention and supporting bereaved families who died by suicide. Now I'm working at Social Inclusion and Safety Promotion Unit of Aomori University of Health and Welfare, and I also worked for Japan's Suicide Countermeasure Promotion Center as non-regular worker. This chart shows the brief story of the Basic Law on Suicide Countermeasures, which came into effect in 2006. In 2000, university students who had lost a parent due to suicide began breaking taboos by sharing their experiences. They then published a book titled Suicide, Untold Deaths. At the time, most of bereaved families were unable to talk about their deaths because of strong prejudice and stigma against suicide. The following year, they spoke about their parents' suicides on TV program. They also met with the then Prime Minister and appealed to him for the need for a national suicide prevention policy. Several years later, in 2005, Diet members and NGOs collaborated to hold a suicide prevention symposium in the Diet, where an urgent proposal for a comprehensive suicide prevention policy was made. Following the symposium, the House of Councillors passed a resolution on the promotion of suicide prevention. The Basic Law on Suicide Countermeasures were enacted in 2006, thanks to the efforts of bereaved families, NPOs, and non-partisan Diet members, backed by more than 100,000 signatures. Please see this schema, which shows the important pathways leading to suicide as revealed by interviews with bereaved families of 523 people who died by suicide. It is clear that those with serious suicidal thoughts have many risk factors which are intricately correlated. This suggests that a comprehensive suicide prevention approach and multidisciplinary and interdisciplinary collaboration are needed to help those at serious risk suicide. The history of this legislation is presented as a case study in WHO's Preventing Suicide, a global imperative. If you are interested in the details, please read that article. This slide shows the basic understanding of suicide in the Basic Law on Suicide Countermeasures and its legal effect on national suicide prevention policy. Suicide is often not the result of person's free decision, but the death of many people who are driven to it. Suicide has a variety of social factors and backgrounds. The law mandates comprehensive national suicide countermeasures and the provision of a wide range of support for bereaved families of those who have died by suicide. It also clarifies the responsibilities of the national and local governments. By the way, comprehensive suicide prevention at the local level consists of 4 pillars. The first is to strengthen regional networks The second is to develop human resources to support suicide prevention. And the third is to provide special care and intensive support to those with suicidal ideation. And the fourth is to raise awareness and knowledge among residents. First, strengthening the local network. Adachi was life support and protection promotion network consists of multi-fields, intersectoral, as well as the health field. The mayor is in charge. The second is to develop human resources to support suicide countermeasures. It is expected that all administrative staff in Adachi Ward will be required to undergo gatekeeper training for novices, creating a common foundation for jointly performing comprehensive suicide prevention work. Third, special care and intensive support for suicidal ideation with a one-stop service, a comprehensive consultation service for people who are contemplating suicide or are in need of help in their lives. Specialists are brought together according to the suicide risk process to provide comprehensive counseling so that residents do not have to search for counseling centers in various fields. Fourth, it is to increase the awareness and knowledge of residents. For example, displays in libraries, publicity papers on suicide prevention from all residents, and so on. Special lectures by public health nurses on how to give an SOS are given to all children at elementary, junior high, and high schools. At that time, list cards of consultation counters are distributed. This table provides a chronology of major suicide countermeasures. In 2008, the money lending business law was revised and a multiple debt relief program was initiated to reduce the number of people who may suffer from severe multiple debts. In 2009, the emergency suicide prevention plan was formulated to save lives. Details of the number and demography of suicides in each municipality were made available. Emergency fundraising for local suicide prevention started. In 2011, the Great Hanshin Japan earthquake occurred. In 2012, a 24-hour nationwide toll-free consultation service, so-called Yorisoi Hotline in Japanese, was launched. This slide shows some of the achievement of suicide countermeasures in Japan. From 2003 to 2018, suicide rates decreased by 38.9% overall, 42% for men, and 30.3% for women. If this number had remained at the same level as its 2009, an estimated 85,796 people would have died by suicide during this decade. What has brought about this rapid decline? It appears to be because of a paradigm shift in attitudes towards suicide and suicide prevention. In the past, suicide was a personal choice and suicide was a personal problem. However, since the law came into effect, most suicides have come to be recognized as driven deaths, and suicide is now considered a social problem. Suicide prevention used to be viewed solely as psychiatric care. Now, however, suicide countermeasures are building a society in which no one is driven to take their own life. From stopping suicide to supporting the living. Suicide prevention used to be considered an issue that should be addressed only by specialists. But now, suicide prevention is everyone's business. From the slogan, life is important, so don't die, to evidence-based policy making. From voluntary efforts to mandates for all municipalities, and of course, the national government. The basic law on suicide countermeasure was revised in 2006. The philosophy of the revised law is to realize a society in which no one is driven to take his or her own life. What are some of the new practical points in the revised law? First, all prefectures and municipalities are now obligated to formulate a suicide prevention plan that functions as a PDCA cycle, Plan, Do, Check, Action cycle for suicide countermeasures. Second, it guarantees sustainable financial support for local governments to practice suicide countermeasures. Third, the national government is to provide advice and other support to local governments. Finally, schools must work to promote mental health and teach pupils how to give an SOS when their lives and livelihoods are threatened. Here are the primary tools and supervisions for each municipality to develop a local suicide prevention plan. First, the Ministry of Health, Labor and Welfare provided the following guidelines: creation of guidelines for the formulation of local government suicide countermeasure plans. Second, the Japan Support Center for Suicide Countermeasures, JSSC, provides profiles on actual status of suicide in local communities, which analyze the status of suicide in each prefecture and municipality. Community diagnosis. Provision of policy packages or local suicide prevention supervises local governments to develop effective suicide countermeasures plans. By the end of fiscal year 2019, approximately 90% of municipalities had implemented suicide prevention plans. It was a success. Shortly after, in the spring of 2020, before the plan was fully functional, the COVID-19 pandemic occurred. It was unfortunate. This figure shows the long-term secular change in suicide rates in Japan. The black, blue, and the red lines are suicide rate overall, male suicide rate, and female suicide rate, respectively. The suicide rate in Japan decreased continuously over the 10-year period from 2010 to 2019. However, it increased by 44.5% by 2020. In particular, the female and minor suicide rates increased by 15.4% and 17.9% respectively, which remained almost flat in 2021. This shows the change over time in the number of monthly suicides in Japan from 2017 to 2020. Immediately after the COVID pandemic in the spring in 2020, the number of monthly suicides was lower for several months than in other years. However, the number of monthly suicides increased sharply beginning in the summer of 2010. Since then, the number of monthly suicides in Japan has remained at a high level. Why did the COVID-19 pandemic increase the number of suicides in Japan? There could be many reasons. Let us list a few reasons. This diagram is the work of former JSSC colleagues. It shows monthly trends in the number of suicides and the number of temporary workers on the vertical axis. The vector autoregulation analysis and granular causality world test reveal a statistical significant granular causality relationship between the number of suicides and the number of temporary workers. In other words, a decrease in the number of non-regular workers leads to an increase in the number of suicides. In Japan, the proportion of non-regular workers, for example, in hotels or in restaurants, is much higher among women than among men. So more women lost their work due to the pandemic in Japan. This may be one of the reasons for the increase in suicides among women. The suicides of a popular actor in July 2020 and a popular actress in September 2020 were sensationalized. This figure shows the potential for these reports to drastically increase suicides due to the so-called weather effect, copycat suicides. Comparison of the number of suicides in the 2 weeks before and after the reported suicide of a popular actress in July 2020 shows a 21.2% increase for males and 45.3% increase for females. Similarly, comparing the number of suicides in the 2 weeks before and after the reported suicide of a popular actress in September 2020, there was a 20.5% increase for males and 51.6% increase for females. This effect may at least partially explain the spike in suicide rates among women and minors in 2020. Japan's Suicide Countermeasure Promotion Center, JSCP, is a government-designated organization that conducts surveys and research on suicide countermeasures and promotes the practical application of its findings. The person in charge will serve a concierge to local governments. Questions and consultations received by concierge and their answers are compiled into Q&A book. Conduct training for newly appointed staff. The community collaboration to support life training program consists of various programs on knowledge and skills related to suicide prevention, according to the experience of the staff. Collection and dissemination of good practices. Provide the actual status of suicide in each municipality. Regional suicide profile. Conduct a survey of the status of suicide countermeasures promotion in each municipality. These are references. Thank you for your attention. If you have any questions about this presentation or about suicide prevention in Japan, feel free to contact me. You are always welcome. That's all. Thank you.
Thank you for your presentation. So when we take a look at what's happening in Japan, since 1999, when the suicide rate was peak, Japan has started to reduce their suicide rate. In the past, Japan has a stigma, and he talked about the hereditary effect, like a copycat suicide. The same is true here in Korea. When the two famous actresses commit suicide, many young, particularly women, also commit suicide. So there's something common between Korea and Japan when it comes to suicide and suicide rates. Also, there is a paradigm shift in how we see the suicide. The suicide is not a personal choice and problem, it's a socio-economic problems. That is really noteworthy. Thank you.
Okay, for this time, let's invite the second presenter, so Mr. Jong-woo Paik from the Department of Psychiatry, the Kyunghee University College of Medicine, and he also worked a lot in regard to the the central the suicide prevention, and he also served as the head of the trauma prevention, the center in Korea. For this session, he would like to talk about the local communities and the suicide prevention. Let's welcome him through the screen. Okay, good afternoon, everyone, and Chairman Hwang Tae-yeon. Thank you for the kind introduction. Let me first congratulate you on hosting the 25th International and the 10th Asia Safe Community Conference 2022 in Sejong. I should have also joined the conference on site, but I would like to ask for your understanding for my not being able to do so for the personal reasons. What I'm going to talk about today is about the suicide prevention measures in Korea. I am currently working in the Department of Psychiatry, Kyunghee University College of Medicine. I used to also work as a director of the Central Suicide Prevention Center at the Ministry of Health and Welfare until 2021. Here I have put the pictures I took with Professor Sorimachi, who gave a lecture prior to mine. It is a true honor on our side to have a safe city-related experts like Professor Sorimachi. He has been working closely with Korean experts since we had a conference in Wonju a long time ago. We also met at suicide prevention related international conferences, and when we visited Japan, he showed us around, he supported us to visit the suicide prevention comprehensive countermeasures headquarters in Japan. So thank you once again for your great presentation, and you have been a great inspiration to us all. Let me first talk about the society we live in. On the left-hand side on the screen, you'd see a drama series poster titled Reply 1988. The main characters in the drama play high school roles there. That means that the characters are around my age, who were born in the 1970s. During that time, a family of four was a typical household type, and I enjoyed watching the drama very much. But Squid Game, which ranked the first on Netflix the last year, has most of its main characters who either live alone or with their elderly mother. And then what had happened for the past 30 years? I think that a survey finding released by Korea Institute for Health and Social Welfare explains very well what drove such dramatic change in Korea. In 1998, when we are asked who needs to look after our sick parents or parents with dementia, more than 90% answered the eldest son of the family. And this percentage dropped to 30% in the late 2010s. 18 to 20% of the survey respondents answered that the sick person need to look after himself or herself. During the previous presidential election, Moon Jae-in, one of the strongest presidential candidates, said that his number one the presidential election, the campaigning promise will be the elderly patients with dementia and how government will take full care of them. What he meant was that the burden of looking after the elderly with dementia would no longer be on any individuals, but on the government. Then what does that have to do with the suicide rate of these days? If you look at these 20 years, the high suicide rates, which soared during the financial crisis, reoccur again and again every time there was a household debt issue or the financial crisis issue in the nation. And the highest suicide rate was committed by the elderly people. The reason was that these elderly people who had not fully prepared who had not prepared much for their old age when young live longer these days but suffer from physical illness, financial difficulties, or loneliness. The rate dropped slightly since 2011. Suicide because the Suicide Prevention Act banned the production and sales of pesticides, which can be used as a poison to kill oneself. And for the past 20 years, Korea ranked the first among the OECD countries in suicide rates. Meanwhile, we ranked the last in Social Support Network Index, which shows that the number of people we can ask for help in times of needs. What it implies is that we do not have many people or a place where we can ask for help in times of difficulties. This is closely related to the high suicide rate in Korea. Sweden, Norway, and Denmark, the three northern European countries, had higher suicide rates than Korea in the late 1980s, but these countries improved their social accessibility to psychological health services and advanced their social safety nets, and then were able to cut down the suicide rate into half. I think Korea also need to work in this regard. And last year, the Korea was recognized by UN as the advanced country. 100 years ago, Nietzsche said that God is dead. Then what does that mean? That means that in the long time, in the past, when the human beings they had a lot of difficulties, and even when the income, the per capita income was about $100, and then but we were very destitute. Our life was very difficult. But there was something that's kind of forced us or motivated us to live long. Maybe that was because we have children, so I have to live on because of my children, or because the God exists. So, but nowadays we no longer have this something that we can hold on to. And then the Nish mentioned that this term, the Superman or Overman, that means that we have to look for the reason that to live alone in this difficult world. And then in this case, that the younger generations of nowadays, they need to look for the reason to live long. But and then as long as they have this kind of the reason to live alone in this world, they can at least overcome in this difficult situation. But it is very difficult for them to do so nowadays. And then so that the suicide prevention, when we talk about the suicide prevention, that means that we society needs to provide some kind of hope, sometimes the reason that people need to live alone. And then as long as we have somebody next to us who can take care of us, then we can live long. And then this kind of this kind of the supporter, somebody who doesn't this kind of the supporter doesn't necessarily have to be the family members or the friends. The country or society can play that role, and that is our responsibility to play this kind of role. And in the previous, the Korean government in year 2018, the Korean government has released the Suicide Prevention the Government Act plan, and then the Korean government has worked on the three major the work on the Save People's Lives campaigning, and then this kind of the campaigning was done under this Prime Minister's office. And then since the year 2018, under this kind of the campaigning movement, the Korean government has started to work on the suicide prevention in a much concrete manner. And then, not only that, around this time, but the Congress has also passed the relevant suicide prevention related the acts, and also conducted the bipartisan forums in regard to the suicide prevention. So that quite a lot of the changes and improvements were made since 2018, and then we are very glad that around 13 the government acts were passed by the National Congress, and then we in last year we are happy to have the Suicide Prevention Center, and as the merged with the central. Merged with the Central Psychological Autopsy Center, and that's renamed itself as a Korea Foundation for Suicide Prevention, and then it has become a kind of the public institution with 80 plus employees working, and then the director Hwang Tae-yeon is working there as the full-time director, so that it has been much more organized, and then also in the Ministry of Health and Welfare, the new team has been a new department has been newly established, and then and then also that we have the very special the mental health the policy officer, the position in the Ministry of Health and Welfare, so that we can also see that there has been the governor's change and advancement in this regard. And this is I've cited from the Rheine's I've cited from this Rainer Kunches, the very renowned the poet in Germany. It says that. There are many doors, and this is the title of his poem is Suicide, and it says that the last door among so many, but the suicide is the door that nobody has that yet to be knocked, and this really implies a lot about the suicide, and then for us human beings, we can encounter many crises in our lives. We face ups and downs, and then when anyone is facing this kind of the risks, and they feel like they're killing oneself, and that if the local government or somebody is there for them, and that if they can be the connecting of the bridge to the hope, then we can lower the suicide rate. And it is easier said than done. But some will say that, isn't it too ideal? So do we really have that kind of the budget and infrastructure to make it into reality? But when we think about how we have responded to COVID-19, and of course, our government officers, a lot of doctors and healthcare workers have done a lot of work. But we the kind of the job that we have done in tracing the COVID-19, the contact, the way that we did so much the contact tracings, and then the COVID-19 testings, and then the kind of the workload that we covered was amazing, and then it was beyond expectation, and then we then were able to save so many people's lives, and that in that case maybe we can apply it to the suicide prevention, and I'm sure that we have the potential and capacity in preventing, in having the relevant the infrastructure, and then also that in the United States, during the mid-90s, the United States also started to witness higher suicide rates, and then the traumas of the family members of the deceased, and then also there were the severe mental disease issues, and then the Congress had adopted this kind of the issues as very core the policies, and then from year 2000, the United States they started to initiate work on the national the suicide prevention plans, and then nowadays in the United States, in most of the local communities, they have the suicide prevention committees in place, and then this committee works very closely with both the private and the public sector. So the two have for the effective social prevention the measures, and then we need to have we need to work very closely with both the private sector and the public sector. And then let me give you several more the ideas. In the budget wise, in the New York, the New York has about the population about it's 20 million. And then it's about 2/5 of that of the Korean population, and then they spend about 2.2% of their entire budget into the health care, the services of that of the New York. And then there are about and they also have a 10% of the government officers working in the field of mental health. And then in Korea, the number of this the amount of the budget that we put in for health mental care services and also the social prevention is very low. And then let me now talk about talk about the Japan's case. In Japan, what I found very impressive was the top seminar. And then in this top seminar, the head of the local government need to present. And then this seminar the lasts for at least the half day. And then this is done. This seminar is conducted in collaboration with both the private and the public sector. And that the reason they run their top seminar in this manner is that they think that having their head of the local government in place in the present is very important. And then also not only the head of the local government, but also the relevant the experts like this mental health expert and the NGOs, the lawyers and the law clerks, and then the various other the relevant persons like the healthcare workers who work in the emergency department. They all come together. To talk about how they can prevent the suicide. And then this kind of the seminar is conducted 9 times a year. And to share with you the case of Korea, we have the kind of the social campaign called the See, Listen, and Talk. This is part of the life-saving the training, and then already 3.9 million the Korean populations have participated in this training program. And then the Professor Sewon Lim, the late the Professor Sewon Lim who had contributed the most in developing this kind of the campaigning program, said about 1.9 million persons have participated in the See, Listen, and Talk the projects. And then what it is about is that through this kind of the campaigning programs, we can easily identify those people who show the same signs of suicide. And then as long as they will, so that it's more like the early detection and then early intervention by the relevant stakeholders. And then also that in this chart from this slide, it says that we need to collect the statistics and the data, and then also that merge into one, so that we also need to share the relevant information for so that we can improve various the aspects. And then, as you can see here, the Sejong City and the various other local governments, they work very hard to prevent their suicide, and then. In Korea, we have the suicide prevention law from year 2011, and then according to this law, it says that the Korean citizens has a right to ask for help to the country and as well as the local government, and if they are exposed to the risk of suicide. And then, to make it more effective, we need to have the specialized team who can help the people who are at risk of the suicide. And then. The way that we can do so is that to prevent the suicide, we need to our effort should not just be limited to sending those people at risk to the emergency centers and then ask them to undergo physical treatment. We need to we established the life saving and the crisis of the response center. And then this is more like the follow-up measures, so that and after having this kind of the center in ready, we were able to reduce the actual suicide rate into half. So at first we just asked those people at risk to we just tell them that, oh, why don't you visit this center? Well, this helps people like you. But at first, only 20% were agreed, but later, we were very successful. So that's these are some of the examples that I would like to share with you. So thank you very much for listening. So thank you very much our Professor Jong-woo Park for giving us this pre-recorded presentation. And our professor has shared with us that suicide is has a very close connection to the social issues that we have and social conditions. And now let's move on to this panel discussion session. So Sorimachi, Mr. Sorimachi, please also come up to the podium and join us join our discussion session. So Mr. Sorimachi, please come up to the stage.
예, 먼저
First of all, let's invite Ms. Researcher Hee-sun Han, and he.
근무하고 계십니다. 예, 한희 선생님 토론 부탁드리겠습니다.
네, 안녕하세요.
Good afternoon. I am the policy team leader for the Citizens Coalition for Safety. First of all, my congratulations on this conference, and thank you for inviting us. The reason why I'm here is that what I'm doing right now at the Citizens Coalition since 2008, we work with the 18 representatives for the bills on the suicide prevention. Currently, we're working with the 54 local representatives, and we made evolutions of the local government prevention measures and their plans. And we also surveyed how much they implemented and how many plans they formulated. Also, we surveyed the budget and community outreach program. There are 50 categories we evaluated, and we selected the top 3, and we made it known in the media, and we also gave award and prize to the 3 winners. This evaluation system is actually underway by the national government, but I believe the private sector also have a say in evaluating what the local governments are doing, so that we can so-called look over their shoulders what they are doing. So we want to be a so-called watchdog for their prevention efforts. So it's been 4 years into this evaluation program, and we are now trying to advance more measurable indexes and indicators. We want to use them for more detailed evaluations. If you look at the evaluation outcomes, you have an idea what kind of efforts the local governments are doing. First, about the governance or organization. Basically, there is an organization, and as you need a recruitment. So generally, all in all, the local governments, when they prevent, maybe people will think about the center. But we have 11 prevention centers in local government. And also there are 40 sub-district level local government, but that less than 20% of the total local government. So the most basic organization is having a center, but again, 2/3 of the Korean local governments have not yet set up the centers. And of course, there is the Department of Welfare or Labor in the local government doing this, but we need organization. The second one is how many people are working. In 2020, the number is actually decreased by 15% compared to the 2019. It's really shocking because we believe that many more people are assigned, but actually they slashed the numbers working in the field. And the number of the how many government officials are working in the field is also important. So how many years they work. Usually people are assigned to the suicide prevention field on average 26 months, but in 2021, this number of service actually also decreased to 30 months. And also, we also surveyed how many people are working in the bureau or department of the psychology or mental health in the local government. But the number sometimes is only 1 and 2, and also some local governments, the 0. So the working conditions should be enhanced. I think that is something to do with how many people are working in the field. But that is also related to the budget. So here is the budget status. So the money is allocated to the tune of 242 trillion Korean won. And out of that, 0.07 or 7.5 billion Korean won are spent on suicide-related activities. But if you compare to what's happening in Japan and the United States, I think very tiny number of the budget is allocated. The central government, like the Ministry of Health, have $30 billion, but in Japan, the Ministry of Labor and Welfare have 8,000 billion won. So there's a really big gap, whopping gap between how much money is allocated between Korea and Japan. So now next question, what the local government should do. the national government strategies or the countermeasures should be closely linked to the local government strategies. But currently it's not, because again, every local government have different situations. So region-specific countermeasures or plans should be formulated. But the problem is still lots of local government don't have any centers, so lack of governance, lack of human resources, also the lack of the budget. But to do so, I think the most important one is the commitment of leaders. So leadership or the leadership buy-in is really important. To attract their attention, I think the voters, constituents should make their voice heard. Maybe if we're calling for more actions, and then they have no choice but to focus on these issues. I think we have been working in this field for a very short time, but more than 10 years we are engaged in the traffic campaign. I think there is a slight comparison between what we are doing in the traffic and what I'm doing in the suicide. For example, traffic accident is also the main leading cause of the death. 10,000 people died in 1999, but now the death rate is down to 2,000. So it's a big decline in the number of people of the traffic accident, but now there's a growing number of the suicide. So the way we reduce the traffic accident death and mortality, if we do more, I'm sure that suicide rate will be also decreased. So just like we made a good choice and actions to reduce the traffic accident, I think we can see the similar outcomes in terms of the suicide rate. Thank you. So this coalition is making the evolutions, what the local governments are doing. Some are doing very well, but some are doing poorly. I think they will be a very good watchdog for what we are doing.
All right, so for our next discussant is Yoon-mi Choi. She works at the Sejong City Mental Health Wide Area Center, and her position is center leader there. So, okay, please. So, as being introduced, I work as the center, vice center leader at the Sejong City Mental Health Wide Area Center. And before I begin, so thank you very much for inviting me to this the amazing event. And I found this event very impressive. I'm learning quite a lot of things. So thank you very much. So for this session, two of the presenters have made a very impressive and full of insight the presentation. As a person working in the field of the mental health, and I would like to talk about our status quo and then also the kind of direction that we should head toward. And the last month, the Ministry of Statistics, and they have released a very recent data on the suicide rate. And then in the Sejong City, in the case of the Sejong City, 17.8 persons among the 100,000 persons have killed themselves in the Sejong City. And then it seems that compared to the early 2000s, well, it seems like the suicide rate has increased about 0.5%. But when compared to the many other the cities nationwide, the Sejong City ranked the last, ranked the lowest. That means that the suicide rate of the Sejong is the lowest. So is the lowest, which is a very good sign. But if we look at the statistics very carefully, but we can see that there were some ups and downs. In the 2017, Sejong ranked the last in the suicide rates, but the year that follows, suddenly the suicide rate goes up, and then it ranked the first among all the Korean cities nationwide. So there was kind of the ups and downs, and then Mr. Sorimachi also mentioned during his the presentation that the suicide, the issue is it's not just a case. It's just not a case of one's own. It's impacted by this a lot of the social issues, and then people are influenced by this the changes in their life, and then also the circumstances, and then some people may feel lonely or feel depressed in comparison to others while looking at the other person's outperformance. And then these kind of quite a lot of the social and then relative issues are kind of influence those individual persons to feel more depressed, and they feel like killing herself. And then as mentioned, the Sejong City is quite doing very well. They managing the suicide cases in Korea, and for the suicide prevention. And but in our society, in general, Korea is never free from the suicide issues, and especially during this COVID-19 era, we are seeing a lot of people who are at risk of suicide, and so that even for those cities who show very low rate of suicide, need always stay alert, and then be cautious, and then always be ready to always be mindful of this issue, because in the case of Sejong, since Sejong City has a very low the suicide rates, Sejong City does not have very concrete the reports or the statistics in the suicide prevention. That means that the Sejong City, even if they are doing very well in controlling in their suicide prevention measures, they need to put more. They need to have more inputs in this regard, so to work better in the suicide prevention. And then as we find out what led people to suicide, when do people feel suicide? And that more than 85% among the women, they felt like a suicide right after they gave birth to their children, and they know they lose their job. And then for those women who had to relocate to Sejong City because of their husbands the job, they feel like very lonely, and then they don't really feel like they belong to this city. That's why they felt sometimes they felt like killing themselves. And then when we look at the teenagers, then because of the burden on their study, they felt like killing themselves. And in Korea, from a very long time ago until now, the teenagers, when compared to other countries, the teenage suicide rate is always very high. And then the reason behind it is their stress on their studies. And then that's why we in Korea we run the 24/7 the call center, where the teenagers can call and seek for help. And then there are not that many cities that run the independent the suicide prevention centers. And then another issue that we need to work on more is that for those hospitals, for those patients who are hospitalized for this mental health issues, and since there are not that many hospitals in the Sejong area, so that it is very difficult when we for these ambulances to refer those the patients to the hospitals. There are not that many hospitals that can accommodate patients with mental health, and then also that we like the follow-up measures. And after they are discharged from the hospital, and then we have run a survey about the suicide, about our perception on the suicide, and then we especially we had this survey on the government officers who are working in the Sejong City, and then we find that the survey results showed us that a lot of the government officers working in Sejong City, they had a lot of the stress, the work burdens, and then they showed a high risk of suicide. And then so that we found out that we need to work more on the mental health issues, but we need to provide better mental health services to the government workers the working in the Sejong City, and then to prevent any secondary the impact in this regard. And also that we need to not only for this government officers but also the teenagers that we and then also the women. I think and then we need to categorize the risky groups per gender, per age group, and then we need to categorize them in a detail, so that we need to provide a much more customized we need to provide customized approach. And then in the Sejong City, there are a lot of the apartment high rises. So that means if somebody would like to kill themselves, they go to the top of the roof of the apartment, and then they would like to fall from the top of the apartment to kill themselves. So, and we need to also train the local residents, so that our neighbors can also help those who show the high risk of suicide. So if there's people there, if our neighbors can also provide some help, and then if our neighbors know how to what to do when we see somebody in needs, then we can better, more effectively approach and help those people who are at risk of suicide. So the suicide issue is not just, it can never be an individual the issue. It should be dealt with together in a collective manner, and then to prevent the suicide, and we need to have a very long-term plan, and then even if at this moment we show lower suicide rate, we need to see it in a longer term and then approach it in a long-term manner. So, listening to what she says, there are quite a lot of things that the center needs to do. And then, this city, Sejong City, is it's kind of the new city, and then it has a very unique features. And then I think that for Sejong City, we need to approach in the much more customized, localized manner, and then in a manner that's much more fit to this. The Sejong citizens. So now let's have a Q&A session. If you have any questions, please raise your hand. Okay. Please introduce yourself and as well as who you are asking your question to. I am Government Officer Kang Hyun-sung, who work in the Ansan City, and then my question goes to Sorimachi. And then Japan also perceives the suicide not as the individual matter, but also this a social matter, and they need to be approached more collectively, working in hand. And you also mentioned that if a celebrity somehow kills herself or himself, and that it has a lot of influence to the general citizens, and then it kind of stirs other people to commit the suicide as well. And as I am a government officer who work in this field of the safety, and in our case, when we for a specific period of time, we somehow notice a dramatic rise of the suicide rate. Then we perceive this kind of the phenomena as disaster. And this kind of the very dramatic increase of the suicide rate is sometimes driven by this the financial crisis issues or the increase of the household debt, and then for this kind of the case, do you think the government can intervene more? So what kind of the government intervention can be made?
Thank you very much for a very important question. I would like to talk about copycat suicide due to popular actor or actress suicides. As I told you in my presentation, it's pity. Many people died by suicide after their suicides. After that, JSCP started some seminar for media professionals about copycat suicide. Several times a year after that. And nowadays, media coverage for famous people's suicides have been greatly improved in Japan. So, yeah. So I agree with your opinion, and so yeah. So, but still, copycat suicides have not been solved perfectly. So we have to try to improve it. Okay?
예, 아마 미디어 관계자들과의 그런
And through this the media conference that the Japan that conducts for about 3 times a year, they were able to lower down the suicide rates of the nation. In Korea, we also have in Korea, we rarely use this word suicide in the media, and recently I attended a seminar with people working with the journalists, and And then what we talked about during that seminar was that if we somehow show if the kind of the killing, the suicide related tools are shown on the TV, it somehow stir people to commit suicide. So that so for this people working in the media sector, so that if they somehow refrain from showing very graphic images of killing oneself, maybe it can also help people to the society to lower the rate of the suicide. And
So my question is to you. I will ask first, sorry. So in listening to your presentation, Sorimachi, what is impressive to me is medical doctor and public employment safety agency or the lawyers, they provide as a specialist, as a one-stop service. Very comprehensive package, I guess. It's a multidisciplined or cross-sectoral consultations. It's very impressive. We try to secure enough budget. We try to develop human resources, but that is happening only in the single Ministry of Health and Welfare. That's it. But we need, for example, the police or firefighter, first responders, but very limited collaborations. I want to know how all these different sectors work together. Even you mentioned that the lending institution law was also enacted so that the multiple debtors can prevent committing suicide. I want to know how we can stimulate the different sectors work together more efficiently.
The Basic Act on Suicide Countermeasure itself recommend intersectoral collaboration for suicide countermeasures. And in the beginning, cabinet office, the government cabinet office was responsible for this intersectoral collaboration for suicide prevention. And also municipal or prefectural suicide prevention plan should include social intersectoral collaboration and initiative of mayors. So, so these structure may support intersectoral collaboration, but still always this intersectoral collaboration is very fragile.
예, 제 질문이 그겁니다. 그 대부
That's exactly my question. For example, you have to work with the lenders, financial institutions. I'm not talking only about the public sectors. We also have to work with the private sectors, how the national local government can engage the private sector to be on board these suicide prevention. This is really tough and this is really important. So public-private collaboration, as you say, they're very fragile, but how we can do more, improve, how we can get this private sector on board, for example. As you said, that is a fragile. You say very honest answer.
I agree with you, totally agree with you. And I think Ms. Han Hee-sun Citizens Coalition for Safety such non-governmental organizations' activity for evaluating suicide prevention is very important. I think we also need such non-governmental organization in Japan. Then that may support intersectoral collaboration, I guess. Thank you.
안실령 같은
I believe that instead of evaluating the public, I think that they can also evaluate the private sectors. Yes. How you can make it possible evaluate the public sectors? Okay, we're working in NGO, but what we are targeting is that we also try to raise our voices and concerns and get across ideas to the local government. And the local government, like mayors, they cannot ignore the complaining voices of the local constituent. Almost every mayor knows what is now being issued and discussed on the ground. What are the biggest concerns for the mothers, parents who have children at schools? For example, I said that I was heavily engaged in the traffic accident. As you see that the parent groups, they ask for the face-to-face meeting with the city's leaders. And I ask that the city should do more, and then that is directly related to the voting. So the leadership should show and demonstrate how strong their commitments are, and that will make a dramatic impact on the plan formulation and implementations. I think that is the right direction.
질문해 주시죠.
Hello, everyone. I am Hwang Ji-Yeon. I work in the. I have a question to Choi Yun-mi. I work in the mental health care center in Sejong, and you have mentioned about the media and also that how to prevent the bullying suicide and then also copycat suicide. And in the case of Sejong, and if we have sometimes, well, when we have the suicide case in Sejong. Sometimes when we prepare for the press release, sometimes the description of the suicide case is too graphic, and maybe we have to be more mindful on the wordings that we use. And so my question is, Sejong City has high number of government officers. And then you also mentioned about the burnouts of the government officers. And then what kind of the projects and do the Sejong City have to help the burnout issues, to prevent the burnout issues of government officers? And well, quite recently, we have seen more the issues. We have seen quite a lot of the burnout issues, and which led to the suicide of the Sejong City government, the government, and then a lot of the press release that we see in our newspapers that are not the right. They do not meet our standard to prevent the suicide. So in many cases, we request that the media outlets that you please be mindful of the wordings when you try to talk about the person who committed the suicide, and please do not show the kind of the images which are too too graphic, so that we make the proposals, and we also contact those a lot of the media sectors, and then we also another the seminar its own way, so that we can be so that we can ask the media sector to work the media sector to be much more to be mindful of the wordings and the kind of images they show. And about your second question about the burnout issues, and so we visited the city governments and then also various ministerial level the government departments. We visited a lot of the relevant departments. So that we propose that we want to do the health care worker we want to provide mental health services to the government officers working in Sejong, but we are working on it, but because of because they were way too busy, and then they simply did not have time to be more to be interested in the mental health issues. But as recently there were suicide cases in the Sejong city because of the burnout, and then the leader of the government leading government officers, and then they were the leaders are very committed to solve the issues about the burnout issues of the government officers. So that I think that we are very optimistic. So that I think we can work more. A lot of the projects are away, and we are very optimistic we can do more. So since we are almost, this session is almost the end, and it's been already 3 years that we are living with COVID-19, and then and then also that in this era of the digital, the digital the advancement, and because of the COVID-19, a lot of people say that the speed of our world has become much more faster, and then but at the same time we see higher the suicide rate, and then the COVID-19 is lingering. It's somehow being subsided. Maybe we can take off our masks fully, but another issue is upcoming, like the social, the financial crisis. Another financial crisis is going to hit all of us, and then the unemployment issues faced by the younger generations, and then and then there are quite a lot of these unfortunate events. It seems like unfortunate events, a lot more. The risks are in front of us, and then it's upcoming. And then if we have this one family members who committed suicide, the kind of the trauma, the pain, the family members of the deceased have to suffer in their lifetime can be very burdensome. So, and then we also need to approach. We need to think about how we need to approach them in a more individual manner, in a social scale. So, that means we have a lot more to do together. So, to finish up this session, thank you very much to our panels for being here with us and leading this session. Thank you.